Okay, let's go through some of the findings on this CT scan of the abdomen and pelvis on Agostino Ciliberto. So we're going to start initially here at the lower aspect. So we're actually starting, the scan starts from the femurs and will march up towards the chest. There's pretty extensive vascular calcifications that you can see here. And as we move the scan up, you can see there's still extensive vascular calcifications. He even has some vascular calcifications in the spermatic arteries. He has an early left inguinal hernia. An early right inguinal hernia. So let me show that to you. So compare here to here, and you can see there's a little bit more density here in the right inguinal canal. So it's not a hernia yet, but it's something that should be watched. He has a pretty generous sized prostate gland, and I think the report said he was on Flomax for BPH. He also has some small calcifications here. Probably these are in the, they're not calcifications within the prostate. Here we see some calcifications within the prostate. These are benign, usually don't mean anything. So as we continue to march up, you can see the sigmoid colon here. And there's a lot of diverticular disease, a lot of diverticulosis here. But as we move up, we begin to see some, so let's continue to move up, and we'll see some changes in the fat right here, consistent with diverticulitis. So this is in the left side of the abdomen. This haziness here in the fat is an inflammatory change. So this is consistent with acute sigmoid diverticulitis. Right here we see some more. So as we continue to move up, here's the fatty changes consistent with the inflamed colon. Again, a lot of vascular calcifications here in the common iliacs. And again, we're moving up now towards the chest. And he has he actually has a giant cyst on his left kidney, and I don't know if he has any left-sided back pain, but this could cause it. Most of these cysts are absolutely benign and are asymptomatic, but this one's large enough where I might consider getting an opinion of a urologist to see if they would percutaneously drain this. It might be surprised. It might give him some back pain relief. More importantly, here we see the aorta, which has got a lot of calcification in it. Hardening of the arteries is what we call that. Going near the apex of the kidneys, I don't really see, this might be a little bit of adrenal gland on the right, but they look normal. And then here's the pancreas, and the pancreas has some calcifications in it. We usually see those calcifications in patients who were at one time heavy drinkers. Here's the gallbladder, which is normal. Here's the liver, which is normal. Here's the spleen, which is normal. Aorta, stomach. And then as we move up, here's the esophagus. The heart has several calcifications within the coronary vessels here, here, and a lot of calcifications within the coronary arteries here. This is not just IV contrast. There's actually calcifications here. Now if we look at the esophagus as we move down towards the stomach, he has a very small hiatal hernia, and we can see that better in another view. So let's take a look at another view here. So here we're looking at a coronal view. Here's the calcifications in the heart, in the coronary vessels. This looks like it's in the left anterior descending, so he's at risk for heart disease here. Colon, transverse colon here. And then as we move, we can see the area of sigmoid diverticulosis and diverticulitis here. This sort of haziness that you see in the fat right here. It's all hazy. This is sigmoid diverticulitis right here. Here's the bladder. Here's the prostate gland. He's got a pretty generous sized prostate gland. And then here's that giant cyst on that left kidney. So the spleen is here, and here is the aorta, which has a lot of calcifications in it too. Right here, the abdominal aorta has lots of calcifications in it. And as we move up, coming now towards the anterior abdominal wall. So here we're coming towards the anterior abdominal wall right now. I don't see any abdominal wall hernias. This to me looks like either he has fat within a left inguinal hernia and an early right inguinal hernia here. So I would watch both of those. Neither one of them have intestine in it, so they don't need any action now. The one on the right seems to have a little more definition to it, but it's not a full-blown hernia yet, and neither is the one on the left in the inguinal regions. But the real finding here is acute sigmoid diverticulitis. It's not that bad. On a scale of 1 to 10, I would say that this is about a 5. Giant cyst in the kidney, spleen. And here is small hiatal hernia, so you might have a little reflux disease from this. This is where the esophagus is entering into the stomach right there. So let's take a look at another set of images. So here, now this is a sagittal view, and it looks like we're moving from the patient's right side, moving through the abdomen to the left side. So here again is aorta, lots of atherosclerotic hardening of the arteries, atherosclerotic disease, lots of disease in the heart, lots of disease in the coronary vessels. Giant cyst on that left kidney, and you can see how big it is. Even has a smaller cyst here at the apex of the left kidney. Here's the sigmoid diverticular disease right here. And as we move down towards the pubic bone, the haziness in the fat here represents the inflammatory process. So if he hasn't had his colonoscopy, he needs one about 6 weeks after this diverticulitis has resolved. And now let's take a look at the hernias. They don't show up well here on this. Pretty generous sized prostate gland. This is a pretty good sized gland here. So I wouldn't be surprised if he has problems urinating. So again, in this coronal view, our findings are calcifications in the aorta, air within the disc, in the disc of the spinal column. This is actually normal as we age. We get some air in there. Calcifications in the aorta, giant cyst in the left kidney, diverticulosis and diverticulitis. And here's the diverticulitis, that haziness that we see here. Pancreatic calcifications, small hiatal hernia, enlarged prostate. And I think the radiologist hit on all of these points. So that's about it.